Kelly Oss, and I've lived in Nevada and Bernie County most of my life. Labor Day weekend, we were with our family, and we had an annual family volleyball tournament, girls versus boys. So we look forward to this every year. I went up to spike the volleyball. My son was on the other side of the net, and Mom can do this. And when I came down, I did not land on my foot, and I had incredible pain, and I had a lot of shock, because I just have never felt an injury like this in my life. And so I've been playing volleyball for well over 20 years. I found out that I tore my ACL about 10 days after the injury. And so prior to surgery, I needed to do pre-op physical therapy.
This is a big moment, Allie. This is like the third time.
Ooh, there you go. Keep your foot. You can get started. Yeah.
I iced it.
So I started therapy 2 days a week, and my initial therapy sessions were very painful in the beginning, but one thing that I appreciated was that the staff was so encouraging. You know, it's a weird feeling to go, from a completely unexpected injury that brings on a lot of shock, and then know you've got to spend 6 weeks doing therapy to then have a procedure, and 3 days later, non-weight bearing straight leg for 2 to 3 weeks. And so it was, I really appreciated the relationship that I had with my therapist and their support prior to the surgery. So I'm currently at 6 weeks post-surgery, and I don't have crutches anymore, which is great. When I hit the 6 week mark, my surgeon had suggested a very aggressive approach at gaining some mobility, which would be what they refer to as a manipulation. And I had a great consultation with my physical therapy staff, actually. And so they listened to my concerns, and we're on a path now that might be a little bit longer in the recovery, but I know I'll gain that mobility, but I'm not in favor of going in for an invasive manipulation. What I really appreciate out of Cheryl is that she really dove into the protocol, and she asked more questions about my injury than my surgeon did. And since I've had this nerve pain develop post surgery, she's actually been able to pinpoint where we think I twisted my ankle. So it's her experience. She also had a knee injury, and she shared that with me, and her encouragement that's kept me positive. And I've just been working with Mel for the last week, and I appreciate her positive, jovial attitude. And she looked at me directly and she said, don't let this steal your sunshine. You're doing great, and keep going. And to hear them telling other patients you can do it in these encouraging words, I feel like that environment, that whole space is very positive. And I think that's important for healing.